Viral esophagitis. So this is commonly thought to be in patients with HIV, especially on the boards, can occur in other immunosuppressed patients who have undergone transplant or patients who are on chemotherapy. These patients present with odynophagia, so pain with swallowing, as well as dysphagia, or difficulty swallowing. These are often confused, and that D in dysphagia and D for difficulty could be a good way to remember it, and they often have retrosternal pain. Diagnosis is generally direct visualization using endoscopy, which you're not going to do in the emergency department, but you might refer to GI to do. You can do an X-ray or a CT if you're concerned for perforation or if you're looking for other causes of the pain. Certainly, if patients have severe symptoms, they're not tolerating PO, they're immunocompromised, you might need to admit them for fluids and IV antivirals or antifungals. If they have mild symptoms, then you're going to end up referring them for outpatient evaluation and outpatient endoscopy.